Welcome to Protecting Yourself from Disease, a Standard Precautions Review course brought to you by American Way University. Once again, my name is Angie Danielski, and I have developed this course to help you review this important topic. In the final portion of this presentation, we will discuss other areas pertaining to standard precautions, including food service, housekeeping, and laundry. We'll finish up by discussing post-incident exposure and exposure control plans. Other areas included under standard precautions and infection control include food service, housekeeping, and laundry. We will discuss each of these areas over the next few slides. Standard precautions greatly applies to the food service because if we are not careful, we can cause residents to become ill. Separating raw meat from other foods we are preparing is essential as it contains bacteria that can lead to illness, such as Salmonella and E. coli. We should also ensure that we disinfect any surface that raw meat has come into contact with prior to putting other foods on that surface. The refrigerator and freezer temperatures should be checked at least weekly to ensure that they are in the proper temperature range so that food does not grow bacteria. The refrigerator should be kept below 40 degrees Fahrenheit and the freezer should be kept below 0 degrees Fahrenheit. It is not a bad idea to glance at the temperature whenever you are going into the refrigerator or freezer to make sure the temperature is still in range. If the temperature is found to be out of range, we must discard any food that was in the refrigerator or freezer. Similarly, we must discard any food that is expired. We can never serve food to residents that has gone past the expiration date, as there is a potential for bacteria to grow on the food. When taking meat out of the freezer to thaw, we should avoid leaving the meat on the counter, especially overnight. Instead, we should thaw the meat by placing it in the microwave, placing it in the refrigerator to thaw, or placing it in cool water or running cool water over the package. This will help to avoid having bacteria grow on the meat. Lastly, if we are saving leftovers from a meal, the food can only be kept for up to 72 hours or 3 days. After this point, we must discard the food. Whenever placing food in the refrigerator, we should make sure that we label the container with the date the food was made so that we know how long it has been in the refrigerator. As mentioned, housekeeping is included in standard precautions, as this is one way that we can minimize any bacteria and germs on surfaces that residents may come into contact with. When cleaning, a disinfectant should be used on all surfaces, since it will kill any germs and bacteria present and help to prevent the spread of disease. We can either use commercially available disinfectants, such as those that we can buy from the store, or we can make a 10% bleach solution by mixing 1 part bleach with 10 parts water. A 10% bleach solution is as effective as any commercially available disinfectant. It is important that we clean resident rooms at least weekly in order to help minimize the risk for illness and/or infection. Of course, it is always important to clean up any spill or mess that is made when it happens to help protect our residents. When cleaning, we should always wear gloves, as you never know what you may come into contact with. Also, many cleaners are harsh on the skin, so avoiding touching these substances can help you to maintain the health and integrity of your own skin. Wearing gloves while cleaning is important to protect your own health. When doing laundry, dirty or soiled clothing or linens should be kept separate than clean items. This is also true that clean items should not be placed back into the same container that dirty clothes were taken out of without first disinfecting or washing the container. When doing laundry, we should always try to keep kitchen linens separate than bedding or resident clothing to prevent cross-contamination. Resident bed linens need to be changed at least weekly. Whenever linens or clothing become soiled, we should also change the linens and throw the soiled linens or clothing into the washing machine as soon as possible. We should avoid letting soiled linens sit, as bacteria may grow on these items. Whenever we are handling soiled linens, we should wear gloves and hold the soiled linens away from our bodies so that we do not contaminate ourselves and our clothing. When you begin working, you should have learned about your exposure incident control plan. It is important that you are prepared and learn about this plan before anything ever happens so that you know what to do if something does happen. If an exposure does occur, you should immediately wash the exposed area with soap and water. Also, the nose, mouth, or skin should be flushed with splashes of water or by holding the affected area underwater for 10 minutes. Eyes should be irrigated with water or saline for 10 minutes as well. After flushing the area of exposure, you need to report the exposure incident to your supervisor, nurse, or designated infection control person. Seek treatment from a healthcare professional if necessary. If you are unsure whether or not to seek medical attention, your supervisor can help determine whether or not you need to seek medical treatment. If an exposure occurs, you need to follow your CBRF's post-exposure incident control plan. This plan may vary among facilities. However, there are some common steps that the plans include. First, you should notify your supervisor of the incident. However, never delay flushing the area to notify your supervisor first. Next, you should document the incident exposure. In documenting, you should be honest and explain what happened. This information can be helpful in avoiding the same exposure in the future for you and your coworkers. In some cases, you may have your blood or other bodily fluids tested for infectious materials. Residents may also require testing. If needed, you may be advised to participate in risk counseling, especially if you were exposed to known human infectious diseases. Often, your exposure incident will be used to help train others and avoid similar exposures. This can also help to plan to eliminate future exposures by adopting new policies and procedures. This concludes the final portion of the American Way University training of Protecting Yourself from Disease. Thank you for your participation. For further training opportunities, please feel free to visit our website or call our office.